This meeting is being recorded, so if anybody would like to see it later, you are welcome to go ahead and view it afterward, if you want to play back anything. My name is Joanne Connor. I'm the President's Chief of Staff. I'm happy to serve as our moderator once again to provide updates to the university community about our plans this time for the fall. We've been doing this periodically throughout this pandemic and are happy to keep doing this as long as we need to so that everybody has all the information that they need and understands where we are going for the fall semester and beyond. With us today, we have, of course, our president, Ali Hushman, as well as our provost, Tony Lohman. And you see in front of you some of the members of the emergency operations team, which has been meeting at times. We met daily, and then it shifted at different times to 2 or 3 times a week, and then to 1 day a week. And so you see some of the members here in front of you, including we have our Senate President, Dr. Bill Friend. We have our AFT President, Dr. Joe Basso. And so today we have 1 hour to hear some updates from key areas of the university, from some of the panelists that you see in front of you. And then we're going to go ahead and do a Q&A. So as we advertise this update to the university community, everybody was welcome to send in questions in advance, and we did get quite a few, and we thank you for that. We have incorporated those comments into our comments, as well as posted all of the answers to those questions and more on the Return to Rowan webpage. And you're going to hear us talk about that webpage a lot because it is your #1 resource for all of the most up-to-date information at the university, including data on cases, as well as all the updates that are sent out are posted there, and we are continually updating the Q&A there. So please go to rowan.edu/return to Rowan frequently if you have questions. That is your primary source for information. Again, questions that were submitted in advance are going to be incorporated into the panelist comments, and then in addition to that, the audience is welcome to submit questions here through the live chat. We're going to do our best to go ahead and get to all the questions. And just as a point to note, the panelists can all see your questions. The audience, because it's a WebEx event and not a regular WebEx meeting, are not able to see the questions, but we do see them. And we're going to wait until after we hear the updates from various members of the EOT, and then we'll get to those questions that come in live now. So what we're going to do is first we're going to hear from a welcome from our president, Dr. Ali Hushman, and then we're going to hear from our provost, Tony Lohman, who's going to provide an update on the academic plans for the fall. Then we're going to hear from the director of the Wellness Center, Scott Woodside, who's going to talk about health and safety. We're going to hear from Dr. Kevin Kett, our vice president for student life and dean of students. And then we'll hear from the dean of our medical school in Camden, Cooper Medical School of Rowan University, Dr. Annette Rivoli, who will provide a medical update. And then we'll also have a medical update from the dean of our School of Osteopathic Medicine, Dr. Tom Cavallari. And then our vice president for human resources and chief human resource officer, Terry Dry, will discuss employee-related matters. We have others here on the panel, as you see, who are available for questions. And again, we're going to do our best to get to all the questions that come in during the chat. If for some reason we don't get to your question, please feel free to reach out to us directly afterward. And again, keep going back to the Return to Rowan website to look for answers there as well. It is a wonderful resource for all of us. At this time, I'd like to turn it over to President Hushman.
Thank you everybody for taking time to be on this WebEx. This is a very important session for us to get ready for Monday or next week when the semester begins. I must say that I'm truly delighted that we are going to see my colleagues on campus and students back on campus. And throughout the pandemic, our goal has been, quite honestly, openness, transparency, and keeping everybody safe. No, we don't hide any information from anybody. This is an open campus, open university. There is fantastic relationship between administration, faculty, staff, unions, and others. We are a family. And every single person, irrespective of our politics and our views regarding pandemic and masking and vaccination and everything, every single person has been affected by this pandemic, one way or another. Some of us far more so than others, but all of us have been. And everybody has had a difficult time. This has not been easy. Therefore, from my point of view, every single person's point of view matters in this discussion. This is not me saying I am right, you are wrong, or somebody else is wrong. It is a very difficult situation. We have had a very, very long period of time that our lives were disrupted, and as a result, I'm not surprised that we are where we are. The only thing that I expect from everybody, and I hope from everybody, is for us to continue remaining civil, working with each other, trying to do our best to keep this great campus and this great university continue thriving and moving forward and be a fantastic place for our students to come in here and get education and for our staff to have a wonderful life and a great career. This is what I wish for everybody. I wish you all a great health. I sincerely hope that we can start and finish this semester and this academic year successfully. I must tell you that the university is in fantastic shape. We are great. We have no financial issues. We have no other issues. The staffs are doing their work. Faculty are doing their work. This is a great, great university. I'm proud of it. I'm proud of all of you because we built it together. Let us continue making it the wonderful university that it is. I don't want to take more time on that. Thank you for being in here, and let's continue the conversation. Thank you.
Thank you, Mr. President. Now we're going to hear from our provost, Dr. Tony Lohman.
Good afternoon, everybody. Certainly this feels a little like Groundhog's Day. Doing this now to the start of the third semester, but I'm, after a rough couple of patches, I'm standing here today. I feel optimistic. I feel positive about our future and where we're going to go. That said, I understand there's a lot of anxiety. There's a lot of concerns. People have been through so much personally in the last year and a half. So we do feel the concerns. We do feel your anxieties. I share many of the same things. In the last 2 weeks, I've dropped off 2 kids into their college dorms. One right up here in Whitney, and I dropped off one in DC. And I'll have 2 unvaccinated kids going off to elementary school this year. So I share these concerns, and I know people are anxious, but we're ready to move forward. We have levels of protection, and you're going to hear from our public health folks, that we didn't have in past semesters. So we have the tools to be successful as we move forward. So I'm excited to see people back. I know I saw a bunch of people today at the Performing Arts, College of Performing Arts had people back for a welcome back. It was great to see faces. I'm sorry I didn't stay around longer, but it was sweltering hot in that heat. But we're moving back. And we're going to go back to what we do best. And a reminder I just want to echo is, fear and anxiety, there's no excuses for lack of collegiality as we come back. There's no excuse for rude or abusive behavior between any of our colleagues, whether you're faculty, staff, whatever union you're in, or whether you're a manager. We're a team, and we're going to get through this together, and we're going to get back on the path we were as an institution before this pandemic hit. Because I can tell you, the president says we're in great shape, and we really are, and the things we're going to do coming out of this are beyond anything any of us have seen before from this institution. So I'm really excited. So really, student numbers look good. The dorms are starting to fill up. The students are here on campus. They're happy. They're moving about, and it's time to really start delivering the high quality experiential education that they come to expect from us. So we have our plan. The plan that we're doing is in line with the guidance. We've been very careful to follow all of the guidance from the experts and how we can open our campus safely. So we have our course formats that are listed in our catalog, and this is the formats that we will begin our semester. But just like last year, we're gonna stay on top of this. So we have our health metrics team that meets regularly, multiple times a week, 2 at a minimum, if not more. As the president said, we are going to be transparent about this data, and we'll continue to post and keep our data updated. And we're going to follow the trends. And if we need to pivot in any direction, we certainly will do it. And many of you were part of what we did on campus last year. We had 30%, almost 30%, if not a little bit more at times, of our classes face-to-face on this campus. And at times we pivoted back, we pulled back, and at times we moved forward. We were successful in keeping our people safe. We were successful in contact tracing. We were successful in our testing program. And that's not meant to be a victory lap or a pat on the back, but it's meant to be, we know what we need to do. So what I'm hearing, particularly on the academic end, is a lot of questions. What if this happens? What if that happens? What if this happens? Many, many scenarios. But as we've learned in this, it's unknown, and we're taking this as we go, and we will pivot. Our health metrics team will be reviewing this. One of the things that worked well for us last year is myself, Kevin Ketton, Scott Woodside, when issues would come up that we hadn't contemplated yet, we met with different faculty groups, and your input helped us guide our policies a little bit better, helped us shape what we were doing, helped us shape the direction. And so to formalize it this year, we've created a faculty and staff advisor group that Kevin and Scott and I will meet with weekly. It's going to be led by Bill Friend, Stacy Cobb, Claude Krimenmacher, Damon Miller, and Mary Beth Walpole. So we'll meet regularly, weekly with this group. We'll share the data. We'll share our decision-making process. They can communicate it back to you. And in return, we also expect them to bring your questions, your concerns. So if you're not getting an answer to a question that is a specific with your class, if you get sick, if this happens, it's not because we're not addressing it. It's because we're going to deal with these issues as they come up during the semester. And we know we can do it. So I know there's a lot of anxiety, but we've got to get moving. We've got to do this, and you've got to put your trust in that we've done our homework, and we've been working very hard for 18 months to make sure this campus is safe. With that, I just want a reminder again, we did this last year with 30% of our classes meeting face-to-face, with limited protective measures in place and limited understanding. This year we have the vaccines. We have good scientific data to help drive our decisions. So we really believe we can move forward. And we've got great evidence right now. Both of our medical schools have been operating, one for 6 weeks, one for a couple of weeks. And so far, so good. And I'm sure we'll hear from Dean Raboli and Dean Cavallari as we move forward. So I'm excited to have everybody back. I'm excited to see our faculty. I'm excited to see our students, and just know, we're always here for questions, concerns, ideas. There's not a single idea we're not willing to listen to. This is our university, and I look forward to the future.
Thank you, Provost Lohman. And now I'm going to turn it over to Scott Woodside, who's going to give us an update on the health and safety.
Thank you, Joanne. And listen, I want to say welcome to our new students and our new employees that may be listening in, and welcome back to our returning Rowan family. And a special welcome to any of my staff that may be listening in. I know they've been working hard and getting us ready for the semester and really the past few years, and grateful for all their hard work. But I'm going to do my best to be brief but informative, as I know we have a diverse audience of students, employees, and parents that are listening in right now. So first, I want to say thank you to our parents and our staff that are here, that are continued dedication to providing our students with an awesome opportunity to learn and transform, as Provost Lohman said, here at Rowan. I know the pandemic has taken a toll mentally and physically, as our president has said, and that's true. And it varies from person to person, but it certainly is true for all of us. And while no one can declare that we're done with this current pandemic, we are transitioning into a different period where most likely we'll be living with COVID in our landscape, most likely in a seasonal capacity. And there's still plenty being studied on what that's going to look like and where we'll be. But I can tell you a couple things for certain. One, COVID-19 is a vaccine preventable disease, and that vaccines prevent hospitalizations and death with extreme efficiency. We're going to continue to offer COVID vaccines through our partnerships with the county on campus and through our amazing team at Rowan Medicine. Actually, a shameless plug, if you want to come visit me this weekend, we'll be there Friday through Monday, 8 to 4 at the Tech Park for a move-in to offer vaccines to students moving in, or if anybody wants to come in, it's open to the public. So we'll be there at the Tech Park from 8 to 4. Hopefully we see some of our Rowan family there. And I want to talk a little bit about the expectations on campus. And again, looking forward to questions later, but just a few of these expectations so you hear them from me and from our metrics team. First, let's talk about our students. Our expectations are students are to wear masks indoors for now. We're going to continue monitoring that. We expect students to maintain physical distancing indoors wherever possible. That may not be possible in all cases, but if an opportunity allows, please do that. If students get tested off campus, they're expected to let us know. So please do that. Eventually, we will find out through our relationship with the county, but the sooner we know, the sooner we can act some of those measures that Provost Lohman was talking about. And you can do that a couple of ways. You can go right to the Wellness Center website and complete a form that submits that goes to me and our COVID tracers, or you can call the Wellness Center 856-256-4333. The next expectation is really to cooperate with the contact investigators. I mentioned them already. I'm training a few more so that we have a robust team. You may also be contacted by a state or county tracer. You need to cooperate with them as well. So we will be sharing that information back and forth. So please be receptive and responsive. They're there to do their job and help out. Participate in testing if you're unvaccinated. That is an expectation, and Dean Kett is going to talk a little more about that. And as Provost Lohman said, be respectful and kind to each other. Actually, as our president said as well. And really, finally, our students study hard and have fun. You know, this is going to be an amazing experience. We're all here for that. Now, for our employees, everything I just said above also applies to you. But also our faculty and our event coordination staff, anybody that's planning events, we're not limiting any in-group activities, any indoor activities. But if you are putting people in a position to be face-to-face in close contact, you know, we ask that you keep track of that for contact tracing purposes. So please be conscious of that and actions that we're taking. And that's a really good transition to some of the public health standards that we have in place here, as Dr. Lohman had mentioned. You know, and as Joanne said, are working hard to put as much information as possible into the FAQs. So please go there and check out, you know, what we're posting. So it's going to be not just static, it will be live. We'll be adding information as we go. And as Tony said, we can't really come up with every possible scenario, but we are remaining flexible and reasonable and responsive to their own community. Any student with a positive test and every employee with a positive test will be interviewed to assess if there's any contacts created in Rowan or outside of Rowan. If a student is in a classroom within 2 days of the onset of symptoms, the professor will be notified in that situation, and our Dean of Students will also reach out with any individuals for whatever reason are not allowed to be in in-person experiences. A similar process will take place for any in-person events. So if the student reports to us that they're in an in-person event, we'll certainly do investigation there. But passing people in the halls, working in the same building, wing, or even classroom does not make you a close contact. Transmission is caused by face-to-face interactions at close distances. And I can tell you from the thousands of interviews that I've done, not just here, but previously in public health, that is the primary spread. That is household environments, sharing meals and gatherings, social activities are really the primary source of spread. Now, tomorrow we'll be sending an email out. Dean Kett and I will be sending an email out. Notices to individuals requiring weekly testing. Those students and employees will report for testing at a designated block of time, either on Wednesdays or Thursdays, and weekly going forward. We also have expanded testing protocols for athletics and the College of Performing Arts for any of those activities. So we're doing a lot of testing. We did almost 30,000 tests in the spring, and we're set to do that or more if necessary this fall. Isolation and quarantine, real quick. For vaccinated individuals, this is the current guidance in collaboration with the state, CDC, and the county, who I speak to on almost a daily basis. Those that are vaccinated are not required to quarantine if exposed to a known case, but they are supposed to wear masks and recommended testing at 3 to 5 days post-exposure. Anyone that is unvaccinated must quarantine for 2 weeks from exposure. As I mentioned, those students will be identified by the Dean of Students, and professors will be notified that they should not attend in-person classes. For students who test positive and live on campus, TRIAD is available to you. It's been amazing for us, and it's been a great opportunity for us to keep students home, especially if there's a vulnerable person in their parent's home. And that will be available to students whether you live on or off campus. Alternatively, you can recover at home during that 10-day isolation period. Just know that isolating in a house does mean those living with you do have quarantine procedures you'll have to follow. Now, I can't talk about TRIAD without giving a shout out to the staff that are supporting these students, starting with Dean Kett, who's been amazing, his staff in student affairs, the Res Life team, and our gourmet dining staff that delivers meals to students in there. They're just fantastic, dedicated people. Now, as I mentioned before, the transition period of the pandemic, as the world begins to interact more frequently with each other, what we're going to see is a rise in respiratory diseases. I can tell you the question I get most often is, should I get a COVID test? I wish I had a nickel, right? Isn't that the expression for every time I get that question? And really the answer is, if you feel like you need to get tested, then you should get tested. But as I mentioned before, we're seeing a rise in other diseases. So if you have a fever, a significant sore throat or a cough, you should not be around other people, right? We should take that time and isolate in those cases. Follow your procedures for that. If you have a loss of taste or smell, those have been telltale signs. Please get tested at that point. If you're unsure, as I mentioned, those forms, go to the Wellness Center webpage, submit those forms if you have a question, or reach out to us. Our students can certainly call. They can speak to a nurse in the Wellness Center. There is no perfect answer. There is no 100% accurate test, 100% effective vaccine. No contact tracing protocol is perfect, which is why we're constantly monitoring, remaining flexible, and we're able to move in any direction that makes sense for our community. I can tell you that I'm grateful for being here. We have an amazing panel. The metrics team has done an amazing job really for the past almost 18 months now. And I'm looking forward to being on here and answering any questions. Thank you very much.
Thank you, Scott. Dean Kett, can you give us an update from student life, please?
Good afternoon. Thank you all for being here. I echo what everybody has said before me. Thank you to Scott and his team for the amazing work that they do. And thanks to everybody who has asked questions and posed concerns. Those are important, and we appreciate the ability to process through those. But I do want to give a special thanks to students. Students did an amazing job last year of following on our expectations, following what we wanted them to do. And I anticipate that that's going to continue this year. So thank you for that. Couple of just real quick updates. We've got about 5,400 students that are going to be living with us on campus. Scott and I are tracking now about 16,700 students who are going to be in person with us in some capacity. Athletics are back and in progress, and we're going to do some amazing things with student activities and in-person events. So excited to see students back, excited to get back to as much normalcy as we can. So I appreciate everybody's work there. Couple of things, and the major questions that I'm getting are, so what are we going to do to protect campus? What are we going to do to help students make sure that they're compliant? Students have to submit proof of vaccination or proof that they have a valid medical or religious exemption. One of the things that did change recently, as we know, is with the FDA approval, personal exemptions have been removed. So we're working with those students on their status, but that goes back to, again, the 16,700 that we're tracking. Please, if you're a student that still needs to turn in your paperwork, it's really critical that we get that in because we're going to be providing information to faculty about status for in-person classes and our residence hall staff about moving in. Those who have the medical and religious exemptions, they're going to test weekly. Scott and his team have a great program set up in the student center. For students who do not participate in their testing, there will be accountability they'll be removed from in-person classes, they'll be removed from housing, and potentially they'll be suspended as a student. So again, I know our students will do a great job of complying with our policies, but if not, there will be a series of accountability with that. Isolation housing, Scott covered very well. Thank you, Scott, for that. As we learn information, we're going to notify faculty. There's some questions in the Q&A. We're going to notify faculty of who's compliant and who's not compliant. We will be very respectful of concerns that people don't necessarily want their vaccination status released, but we will release compliant or not compliant. And then if we reach a time, so we're in the first 2 weeks, will be masks. If we get to a point where we're not masked, then we will let faculty know who must mask and who don't, the students who don't have to mask. So we will share information in an appropriate way that educates our faculty, gives them the information they need, while at the same time respecting what students need. Faculty, you should be receiving that information this weekend, just as quickly as we can get that information reconciled with the Wellness Center and the great job they're doing. We'll get that out. During the semester, again, lots of questions about what happens if I contract COVID or if I can't be in class. That's something that's a really class-specific relationship. So faculty members will get a notification from my office saying, hey, Kevin Kett can't be in class for this period of time. That could be for a number of reasons. It doesn't necessarily have to be COVID related. It could be a lot of reasons. can't be in class for this period of time. Each class is going to be different. It might be that what I do to make up my work in an art class is very different than what I do in my engineering class, et cetera, et cetera. So for some, that might be additional writing work, et cetera. We're going to leave it to the faculty to decide those. But students, if they're out, will have the right to make up their work without penalty, and faculty will have the flexibility to create opportunities that will work for them as far as making up work. Other questions that we see, great questions from students about what about student groups, clubs, organizations, activities? We expect them to be back in full force. And again, we ask people to be reasonable. So if you're going to have a large group together, we would expect you to be masked. We would expect you to take reasonable precautions, social distance when you can. But if you're in a group that has 3 or 4 or 5 people and they're all vaccinated, it might be reasonable to take your mask off. So students, if you have clubs and organizations, we just want you to use good common sense. If it's reasonable to mask and you've got a large number of people, please do that. And if not, we certainly understand that piece as well. The other piece that keeps coming up is, again, this idea of respect. We really need to hold true to that if I'm in my office and Joanne comes into my office, every student or every person that's come into my office in the last couple of days, the first thing I say is, would you like me to put a mask on? We have to try to respect the fact that people have different thoughts and philosophies. And so if somebody asks you to put a mask on, I would ask you that you be courteous and do so, just out of being a good human being and a good person. So we're going to have all those conversations a lot. You know, what's the environment? There is no one size fits all answer. There's lots of scenarios that we could think of. So just feel free to have those conversations. We asked, if you need a mask, we have those. Contact the Student Center. We'll certainly distribute those as long as supplies last. Please report concerns. If you have concerns, there are mechanisms on the Dean of Students webpage to report concerns. We will respond to those. I promise you, we take those very seriously. And again, we just ask that people be respectful. Lots of good things happening, lots of exciting things happening. I can tell you that we're working very hard to try to do all the right things to make sure people are compliant. And if there are questions or concerns, please have a little grace. We'll respond to you as quickly as possible. But we are doing what's in the best interest of the university, and we'll continue to do that. Thank you.
Thank you, Kevin. Before we get to the deans of our medical schools, Tony, did you want to address wastewater testing?
Yes, thank you. I meant to get that into my initial remarks. I know that question came a couple of times prior to the meeting. And wastewater testing is something we're going to be using this semester that came directly out of our conversations with faculty who had ideas. It's being led out of engineering and CSM. And we did spend the spring really trying to pilot test, actually get some of these systems down into the wastewater tunnels. And we've begun to baseline that data. And as we get the semester started and we start to understand really what the data means and make sure it's validated against all the standards that are set, that we hope to use that as a tool moving for this semester. So as soon as we have that validated and as soon as we have that up and running and are using it as a tool, we'll of course be making that data available to our community. And I should just want to add that to me, that's one of the comments that I want to go back to is, again, all ideas are ideas that certainly we want to consider. So we encourage people to come forward with thoughts on things that we can do that are reasonable and based in science.
Thank you very much. Okay, now we're going to hear from the Dean of our medical school in Camden, Dr. Annette Riboli.
Good afternoon, everyone, and thank you for joining this session to all the participants. I've spent about 4 decades practicing the subspecialty of infectious diseases, and during my career, I've also served as a hospital epidemiologist. During the pandemic, this particular COVID-19 pandemic, I participated as an invited member of a professional advisory committee, which informs the Commissioner of Health, Dr. Persicelli, on a variety of issues with respect to the pandemic, including the rollout plan for the vaccines, how to allocate ventilators if it came to that in the state of New Jersey. I've also actively served on Rowan's Health Metrics Committee and on the Emergency Operations team. The team started meeting at the start of the pandemic and continues to meet to this day. I have a few general comments about the pandemic. Prior to the end of 2019, this particular coronavirus was not known to exist. And therefore, there wasn't any type of a playbook on public health response, prevention, or treatment. And I always find myself saying when I speak to our students at the medical school that this pandemic is going to test our adaptability, our flexibility, our emotional intelligence, and also our tolerance for ambiguity, because sometimes you will see advice change, including from bodies like the Centers for Disease Control and Prevention. Now, during the pandemic, there have been a number of scientific strides made, including the development of the highly effective vaccines that Scott Woodside always talked about, personal protective equipment, and other treatments to actually treat people who are infected. Throughout the pandemic, the university has followed the science. You know, people use the term follow the science. The university has consistently followed the science in their response and the measures that they've put in place. And I firmly believe that Rowan will continue to do this. And although the pandemic will eventually end, you know, some people have leveled predictions about when that will happen. No one knows exactly when this will happen, but certainly variants of this coronavirus will remain with us indefinitely. And in many ways, we're going to need to learn to live with it and take measures that provide reasonable protection. The first line of defense is vaccination. So I urge everyone who's not vaccinated to go out and do so. There's ample vaccine available. A high rate of universal vaccine will be our best ticket out of the situation that we're in now with the pandemic. I wanted to address a couple of things, though, about the vaccines. As Scott Woodside mentioned, they are highly effective, and they're effective against the important things: hospitalization and untoward outcomes, death predominantly. For those who are vaccinated, you may have heard about breakthrough infections. And yes, there are breakthrough infections, especially with this new variant, the Delta variant, which is much more contagious than the original Alpha variant that circulated. This is the dominant variant circulating right now in the United States. So that's why masking, you know, has returned on the scene. It's not a contradiction or anything like that. Masking is relatively simple, and most of us have gotten used to that. The vaccines do confer some side effects. Every single medication that has ever been produced and every vaccine that has ever been produced, no matter for what entity they're available, have side effects associated with them. And in medicine, we're always weighing risk versus benefit. In this case, the risk of a serious outcome from natural infection is much higher than the risk of any side effect from the vaccine. And some folks have asked specifically about things like effects on the heart of the vaccine. That is being actively assessed and tracked. And the number of cases is relatively small compared to the number of individuals who have been vaccinated. The risk of developing a heart problem from natural infection with SARS-CoV-2 is significantly higher than the risk of getting this from the vaccine. All viruses can cause myocarditis and pericarditis. Please keep that in mind. Another myth is that if you've had active infection, you don't need a vaccine. That is not true. The protection afforded by the vaccine is much higher than natural infection. There's also a concern, will the vaccine affect your fertility? That is a myth that got circulated, and the answer, quite frankly, is no, it will not affect your fertility. So that is it for my brief presentation. And again, thank you for participating today.
Thank you, Dr. Raboli. And now we're going to hear from the Dean of our School of Osteopathic Medicine, Dr. Tom Cavallari.
Good afternoon, everyone, and thank you for inviting me to be part of this. And I just have a couple comments. Dr. Raboli and Scott did an excellent job in presenting a lot of the safety and healthcare medical aspects. I really want to just start out by saying that as a physician, I really feel very proud to be part of the team that has been overseeing this, working with Dr. Hushman and Dr. Connor and the full team. I mean, very clearly, the focus has been we need to do everything we could to keep the campus safe. And I interact with other medical schools and other university college campuses, and I haven't seen the focus, the ability to be informed by science, and the ability to take information each day that comes and apply that and pivot in a way that it's focused on one thing, that is keeping our campus safe. So I really want to share that information. I feel strongly about that and have been proud to work with the team on the health metrics team. We have been back on campus here since mid-July. Our students started early, and we have utilized all of the recommendations for safety that have been coming from the health metrics team. We have a local team that works closely with the health metrics team to keep everyone safe. With this new information about the Delta variant and concerns that have emanated from that, we actually instituted the mask wearing policy, quite a number of days ago, and it's been working out very well. The students, faculty, staff have been utilizing mask wearing indoors, and I will tell you, everybody is compliant, and we haven't seen any cases, outbreaks, concerns. It's really working out very well. So I obviously the two medical schools started this because we've started classes already, and I'm sure it will work out extremely well as we've seen on our campuses. We have had, you have all heard about the Rowan Vaccine Center that we've had on our campus, brought it to your campus too in Glassboro, and we continue to administer vaccines. So I could just reinforce what Dr. Raboli said. It is safe. It is the most effective way for prevention. Of course, yes, social distancing, hand washing, etc. But the foremost form of prevention is in fact the vaccine. We've administered Moderna on this campus, but we also now on our site here and soon to be in all of our offices will have Moderna as well as Pfizer available. So as we move forward, we have a lot of optimism that things will get better. But as Dr. Raboli said, we need to be persistent. I think on our campus, in our community here, we're doing pretty well with the number of individuals vaccinated, but we need to do even better. So we encourage individuals to get vaccinated. We're confident of the safety. And, quite frankly, what happens is the more people that are vaccinated, the less likely this virus will be around to be able to mutate, and things will eventually improve over time. Who knows when, as Dr. Raboli said, it'll be with us a little bit, but it'll be more and more safe as time goes on. So I just want to say again, I'm proud to be part of this community here that is focused on enabling us to do the things that we do, to educate, to train, to care for patients, to help our students advance, to our research to continue, etc., but yet in a very safe manner. I'm proud to be part of that group, and I'm confident we'll be successful. So thank you for allowing me to make some comments here.
Thank you, Dean. Now we're going to hear from our Vice President for Human Resources, Terry Dry.
Hi, thank you for having me. Let me apologize in advance if we have technical difficulties. I have to be out of town for family obligations, and apparently we don't have high-speed internet yet in Pittsburgh. So hopefully you'll be able to hear me. I thought it was very important that I be able to be here. As everyone has said, we're starting the semester in a different public health environment than we really had anticipated. However, we do know how to prepare. We've had 30 to 40% of our employees on campus since July of last year. So we know what we need to do. We know what, how we minimize the risk. What we can promise is that we're going to continue to be flexible. We're going to be responsive, but we're also going to continue to make certain that we're able to provide student services and patient services on our medical campus. We understand that employees feel uncomfortable and employees feel uncertain about what will happen. And employees should feel comfortable reaching out to the Employee Assistance Service. We've had a phased return to campus, but beginning September 1st, employees should be returning to campus on site. I'll discuss flex work in a little bit, but while I have everyone on the WebEx, I do want to mention an important note though. If you're an employee that was hired after March of last year, if you completed your I-9 virtually, you do need to come in person to HR. That's required by law. We have to actually verify the document in person. So the first thing I wanted to mention was vaccinations. So we are making very positive progress in documenting our proof of vaccinations. Our regular faculty and staff exceed 86%. And that number, that 14% difference also includes people who are fully remote or on medical leave. So I think we will end up well over 90%. Some of that, as I mentioned, they're off campus. So we are also, one of the other things we're doing is we are collecting information from adjuncts and part-time employees. So we are receiving probably 200 to 300 documentations of vaccination from adjuncts part-time every week. I'm often asked about employees submitting medical or religious exemptions. At this time, the vaccination is not mandatory for employees. If you listen to the governor's directive, it indicates employees must either be vaccinated or must be tested. So at this point, unless there's an elimination of the testing option, we don't need to have medical and religious exemptions. Testing will begin late next week, as Scott Woodside mentioned, for those that have not submitted proof of vaccination. This will not include those employees who are fully remote. Employees will have the option to provide proof from a third-party provider if they prefer. And it is important to note that because there is also some confusion, a medical or religious exemption does not exempt you from the testing. As Dr. Kett indicated, we certainly want everyone to be compliant, but failure to be compliant will be taken seriously and may result in disciplinary action. The other question that came up frequently was employees are concerned about what will happen if childcare centers or schools need to close. We were very flexible last year, and Rowan will continue to show flexibility whenever possible. Some positions are considered on-site essential, and we need to maintain that for the safety of our students and patients. But for those that can be accommodated with the temporary remote work, we'll do everything possible to make that happen. So this remains very fluid, and it also remains and is being discussed ongoing with the New Jersey Office of Employee Relations. So frequently we also respond to the directives of the state. The other thing that people discuss is remote work. The governor rescinded the COVID accommodation effective July 4th. So therefore, if someone is requesting remote work outside of the flexible work policy, it requires the completion of the Federal Americans with Disabilities documentation. Following this process really provides for a fair and equitable review of the basis of the accommodation. And it also satisfies compliance with federal law. So this process is an interactive process. It's not something that is just looked at by one person. It's grounded in the medical documentation provided. It involves human resources. It occasionally involves speaking to the employee's doctor for clarification, the supervisor to determine whether we can operationally provide the accommodation, and frequently the division leader for approval. So the decision is not taken lightly, and it involves the opinions of many people in that process. The flexible work process that I mentioned was also developed through a very collaborative process over several months. And I know for some, there's not as many flex work days as they would have liked, and there's some that are unable to do flex work. But this process really was involved and developed through a team of employees, many non-managerial employees who had input into the process. There's a comprehensive policy online, and there's a process for requesting remote work. The flex work opportunities really depend on the type of work being performed. It also depends on whether the employee is non-exempt or exempt. It also depends very much on the operational needs of the department. So the remote work application needs to be first compliant with the policy. It needs to meet the operational needs of the department, and it needs to be approved by the supervisor and the senior leader of the division. So we're really, this is new to higher education. Many of the state schools are not offering it at this point. They're really studying it. We want to be flexible. We want to be proactive. So we're beginning in a limited manner so we can feel certain that we can respond to the needs of our students and patients. So ultimately, the supervisor is responsible for the operations of the department and the achievements of the goals, and therefore they are the primary approval for whether someone can be remote outside of the policy. So I look forward to answering any other questions that you might have. And I hope the technology was okay. So thank you.
It's great, Terry. Thank you so much. I'm actually going to start with you because we had a few questions come in while you were speaking. There was a question about what to do if you see somebody who's unmasked as an employee. Can you handle that, please?
Yes, I mean, there's a number of different options. I would certainly hope first that you feel comfortable going to your supervisor. But you may also, contact HR. You can report it through the HR at Rowan email. We do take this seriously because this is a safety issue. So that, please make sure that you're looking at the website. Masking may change as we come on campus. But right now, if an employee's in a private office, then they do not need to be masked. But please feel comfortable reporting it and feel comfortable wearing your mask or asking someone to wear their mask. We know of someone within, our group in HR who has someone who is in their home receiving chemotherapy. And even though she's vaccinated, she wants to mask. And we are all respectful of immediately putting on our masks when she comes around us so that we're all being protective of that health issue.
Thank you. And before I continue with you, Terry, can we just hear on the student side what somebody should do if they see students who are not compliant with the mask mandate? Kevin?
Again, I would say that somebody should feel comfortable expressing and talking to people in a respectful way, but we also have procedures for reporting on my webpage, reporting concerns if they see a student that they'd like us to look into, faculty, staff, any kind of concern they have related to COVID, they can submit to us and we will look into it.
Okay, thank you. We've talked about the situation and why the employees are not mandated for a vaccine. Terry, I'm not sure if you want to add anything else to that. There's a few questions about that.
Okay. I think the primary is that the first way that we want to manage it is by proactively analyzing and collecting the information. The second thing is that most of our employees are members of collective bargaining units, and that topic needs to be negotiated, and our contracts are negotiated by the state of New Jersey. So, we really need to work through that process. There's some ability to do local negotiations, but primarily we want to do it in the way that will work most expeditiously. And so far, as I've said, we've had a tremendous response. If we're to within 10% of our total population, I would expect that many of those are religious and medical exemptions. So I think we've achieved what we needed to achieve without mandating it, but we would certainly be open to it if the state chose to do that.
Okay, and Kevin, for you, how will religious exemptions be verified?
So we have a process where students have to upload both their proofs of vaccination and or religious or medical exemption requests. That's processed through Medicad and the Wellness Center team. They do their vetting process, and then they send over to me the list of students that are compliant with vaccination or compliant with exemptions, and that's what we use as our database. So the Wellness Center is doing a great job of processing those records, and they send me updates with compliance.
If I could just add to that, that's why we ask for some patience, because we do have to read and verify all the information, whether it's a COVID vaccination card, a medical exemption. So please be patient, those of you that are waiting, who just submitted and are waiting for it to be cleared and sent through. We're working as diligently as possible.
Thank you. And Scott, will the university require students to receive booster shots if and when they are available?
Yeah, it's a good question. Right now, they're not available to this population. But as you know, and I've been on record saying this, I can't think of another university that's had more access to vaccines than Rowan University, between Rowan Medicine and a relationship with the county. That's something that, as a metrics team and the university, we will look at and decide once it gets to that point where we're looking at that. But as we've mandated vaccines now for our students, it is likely that that's the case, although I can't give you a specific answer on that right now.
Okay, thank you.
Can I do a follow-up on the religious exemptions, because I'm getting a lot of questions on that. First, I'll just speak for myself. A strong, absolute defender of the First Amendment. Religious freedom is part of that, and I absolutely support religious exemptions. However, what I'm hearing anecdotally, not just at Rowan, but at universities throughout New Jersey, is the number of students applying for religious exemptions is skyrocketing. There are websites which tell students how to essentially submit bogus religious exemptions. So do we have any way of checking to see if those are sincerely held, which is my understanding of the law? So for instance, if a student comes in fully vaccinated, including with a meningitis vaccine that they get at the age of 16, and then declare a religious exemption, are they being asked what specifically has led to a change of heart, especially since so few religions are opposed to vaccines? And I think that's worth emphasizing.
Chapter 57 of the Administrative Code doesn't allow for that type of examination. It says it allows for a religious exemption as long as it is an attestation by the individual and signed by the individual that it's against the tenets of their religion. Then under constitutional law, there is no challenge there that's legal, from my understanding, in dealing in public health in New Jersey for the better part of 2 decades. So I don't believe that's the case. We've discussed that, and many universities are struggling with this as well, Bill, for sure.
Okay, so we're hamstrung by state law, essentially.
Well, it is in the sanitary code, yes.
Okay, thank you.
Tony, there's a bunch of questions about non-compliance of mask wearing in the classroom and how to handle that. Can you please address that?
I will, but probably Kevin is better set to do that, as he's hosting all the policies. Kevin, are you comfortable? Or I could take it over. I
apologize. What's the question?
Mask wearing. How we're going to oversee our policy of mask wearing in the classroom. And again, yeah, so as I tee off to you, just this is an issue. Again, with the 30% or so class last year, we put policies in place on how to do it. So Kevin, why don't you just follow on?
Yeah, and again, I think that most of our students are going to be compliant, and I ask our students to be compliant. Please, while we're here in these 2 weeks of masking, I would expect you to be masking. If faculty are in a class and students aren't masking, I ask that they report that to me, and we'll hold them accountable, just as with testing. If somebody's not being compliant with university policy, this is in the code. If students are not compliant with university policy related to COVID and healthcare, then they're subject to the code, and that could result in removal from class, removal from housing, and suspension from the university, just like not complying with testing requirements. So I would ask that faculty and students report their concerns to us, which happened last year. We had faculty report concerns, students report concerns about faculty not wearing masks. And so we've got a very robust process in place. It works well. We address it. Terry and her team, we work very well together on those concerns and those complaints. So there are processes to report those, and I promise you we take those seriously and we will address them.
Thank you. Kevin, we talked about the fact that the faculty are going to receive lists of who is compliant, not who's vaccinated or not, but who's compliant. There's a question about whether or not professional staff will also receive those lists.
Well, it depends on the scenario. So, for example, our housing team has access to that list. If a student is not compliant, that's why Scott will be at the tech park. The students have to go to West Campus first in order to get authorization to move in. There will be information given to individuals who have student workers that are in person. So basically, if somebody is working with a person that's in an in-person capacity, we will share that information. If not, we will not share that information in order to protect the students' rights.
Thank you. There's a question. Can we ask if the students if they are vaccinated?
Yeah, I mean, by definition, yes. You can ask if anybody's vaccinated. Where we have to be very clear with faculty, staff, and students is you cannot ask why. You cannot go deeper than that. So yes, it is in everybody's right to say, Tony Lohman, are you vaccinated? And he has the right to answer me any way he wishes. I cannot go further than that. I can't say, why are you not vaccinated? Why? I can't go deeper. So yes, you can ask the question. It gets very complicated of why you would ask the question if you can't go any further. But that is a question you can ask. You just can't go any further than that.
Okay, we need a little clarification on the mask mandate. Scott, can you please clarify? When does that begin?
So the mask mandate, I believe we set will begin 9/1, the first day of classes, and really the CDC has put out a recommendation for anyone in an area what they consider high transmission. So we looked at that and we wanted to adhere to that and follow that protocol and actually require masking indoors in large gatherings. So I just want everyone to know, we look at that data. We also look at what's called the Cali score, which is the New Jersey assessment of transmission, which actually puts us at a much lower level in Gloucester County and Camden County. So we're looking at all that, and we just decided that was the best approach to require masking in those large settings where we're requiring people to gather. However, we talked about in smaller groups, and the CDC does make an allowance for this. If you're in a smaller setting and it is agreed upon, you're vaccinated, you can all choose collectively not to wear a mask. But as everyone has really said, I think the measure has to be, if even one person would feel more comfortable wearing masks, everyone should have a mask on them at all times and put the mask on. That is the expectation that we have, and that is a reasonable way to approach this. But indoors, we're asking for masking when you're in any type of large gathering.
Thank you. There is a question about a definition for an indoor public setting. Scott, are you able to address that?
Yeah, I'm not exactly sure how to answer that question. So I mentioned.
I think it's if you could talk broadly about definitions in general and kind of the difference between where we were last year when we had thousands of students on campus versus where we are now in terms of the guidance.
Yeah, I mean, so indoor setting is indoors. So if you're indoors and there's lots of people around you, there will be a large gathering indoors. I know we talked about hallways and what that looks like, and that's why we extended that to be, if you're in an indoor setting and you're with other people, you're expected to have a mask on, unless you're in a isolated area where you're not around other people, you're in a small group, and there's an agreed upon idea there that you can take your mask off, or you're fully vaccinated, you can do that. But so we're trying to be flexible and yet let people know if you're indoors, you're expected to have a mask on when you're around other people. That is the expectation.
And I think it's important to note that we have this in place for 2 weeks, but we will be re-examining that. And again, we have to really stress the fact that we are prepared and to continue to be, as we have been all along, flexible and to ebb and flow with the data. It's Tony's favorite saying. So if the data shows that we need to continue that mask mandate, we're going to continue. When it looks like things are stabilizing, then we will remove restrictions. Whatever we need to do, we're prepared to do following the data. Okay, Tony, there are a couple of questions early on just about what to do in different classroom situations. If somebody is quarantined, what kind of accommodations do they need to give to those students? Can they hold virtual office hours? Things like that. Can you please address some of the academic questions that have been coming through?
Yeah, sure. So talking about quarantine, obviously each case of quarantine will be different, and just like in any situation where a student is unable to attend a class, that we work with the individual instructor to provide the accommodations to make sure the student has the ability to make up the material. Is an option at some point. Some type of remote attendance. It's certainly possible, but it depends on the level of disability and how long the student will be out. What was the other question?
About virtual office hours.
Virtual office hours. So this is a discussion we had with the Dean's Council yesterday, and that's really come up. We certainly want our faculty here engaging our students the best we can, and we're going to leave it up to the individual departments and deans and colleges based on their individual spaces, their the need, demand. Are there larger collaboration rooms in these spaces where they can hold them? Can they hold them in open space lobbies? Are the offices available to do these things? So certainly we're going to give discretion to the departments, faculty, and the deans to approve how office hours are formatted.
And will study rooms be available?
Yes, our study rooms will be available.
Okay, great. Kevin, can you please talk about the current percentages of our vaccinated students?
So percentages are obviously difficult to attribute. We've got 11,675 students that have given us vaccination records that we've been able to confirm. And so percentage-wise, it depends on what you're looking at. But if I pull up, we're running about 90% vaccinated, 10% not vaccinated for those that have reported. But I think it's more factual to say that we've got 11,675 students who have given us vaccination, and we've got probably about 4,000 students that we are still tracking to get their records, and we do that as quickly as possible.
And can you speak, please, to what happens to those who previously had a personal declination, and what do they do now?
Yeah, that's a great question. So what we've done is we've sent out a message to the students who had personal declinations, and we've shared with them they have the choice to either get the vaccination and show us proof of vaccination, or submit a valid religious or medical exemption. Again, those will go through the Wellness Center, and they'll be expected to do one of those two. Those students who are not compliant, again, if they're trying to move into residence halls, have to go to West Campus first. If they're not compliant for classes, they will not be allowed to go to class until they are compliant, and those records will give to faculty.
Thank you. There's a question about the types of masks. Do we have any criteria for the types of masks that are being worn?
No, it has to be a face covering that covers both the nose and the mouth.
Okay, thank you. Let's see. Terry, there was a question for you. If you could please talk a little bit more about the mask mandate as it relates to cubicles.
So the cubicles really depend upon how the layout of the cubicles are. If the individuals are spaced and pointing in different directions, as long as someone doesn't request, then they wouldn't need to be masked. But if the area is a small area, if it's a low wall, if there's a lot of people that walk by, then they need to be masked.
Okay, thank you.
Mm-hmm.
What kinds of tests will we be using, Scott? Nasal or swab, it says.
So for our surveillance testing, we'll be using a shallow nasal PCR test. that'll take place. We also have PCR nasal testing available in the Wellness Center and rapid antigen testing available in the Wellness Center. And we use a combination of these, I mentioned before, with athletics. We've done a lot of testing with athletics to help make sure athletic continued, and we're very successful with that in the spring. Hopeful the same in the fall, and the same thing with College of Performing Arts. So we have multiple modalities there. So we'll be testing individuals at the Wellness Center who are symptomatic or who are contacts to COVID, and then our asymptomatic surveillance will be for unvaccinated populations.
Thank you very much. Dr. Basso, is there anything that you would like to add to the group? You're on mute.
Unmute, there I go. Thank you, Dr. Hunter. I just want to add this. I've listened to this whole presentation, answered a lot of questions, raised a lot of questions that I have. I'm reading some of the comments in here, and many of which are valid, some of which are raising other concerns. This is a fluid environment we live in. We don't know what's going to happen tomorrow, let alone what is happening at this very minute. All I'm going to do is I want to reiterate and urge something that the provost spoke about before. We need to maintain a level of civility with the way that we are asking things. As everybody in the administration knows, that I'm certainly not shy of contacting when I think there's a problem and having frank discussions. The provost and the president were foolish enough at one point to give me their cell phone numbers. And so I have no problem reaching them and having civil discourse and discussion. And we can disagree and we can come to resolution. I just want to urge everybody, though, when it gets personal and when it gets argumentative, that all that does is muddy it up. So let's deal with sparks before they become fires. And that, I think, is a really important, I don't know the answers to everything. Trusting other people we can come up with some good solutions to things, but let's do it the right way and know that we have to be in this together. So that's really all. I don't profess to be an expert on COVID or anything. I'm not even sure I'm an expert on the law as I'm reading some comments here. But certainly I can be an expert on the fact that we need to have civil discourse. That's my entire.
Agreed 100%. Yes, thank you very much. We're a little bit past our time, and unfortunately we have not gotten to all the questions. Many of them are very specific about specific situations, and so we encourage you to reach out to the appropriate divisional leader to ask those questions, talk with your supervisors. Again, please visit often the Return to Rowan webpage. There are many questions that are answered there that are coming through. We also hear from some of the questions that are coming in. There are more comments, and we appreciate your comments. And it really does speak to the fact that there's a lot of concern, there's a lot of anxiety, and we appreciate this. But it is, again, as everybody has said, time to be respectful and to have civil discourse and to come together to ensure the safety of all of us and our loved ones for when we go home. With that, I'd like to turn it over to the president for some final words, and just want to say thank you to everybody for being here. Mr. President?
I want to also thank everybody for paying attention to a very important discussion today. I want to thank all the panelists who really, in my opinion, gave their honest answers. As the speakers, all of them said, we really don't have all the information. The best that we can do is to listen to pay attention to science, pay attention to the regulatory agencies, whether it's at the state level or federal level, and do our very best to keep this wonderful campus going and keeping every single member of our community safe and secure. That's really my hope. That's everybody's hope. And again, I want to re-emphasize one thing. This is a situation where nobody can come and say, I am right and somebody else is wrong. We are all anxious. We are all worried. We all have reasons to be worried and to be fearful. Many of us have lost loved ones. And as a result, I am not surprised that there are degrees of tension and anxiety, but as much as possible. Let's be civil. We are in a great university. We are in a great country where people are free to speak their mind, to express their views. Let's do it in a way that we can move forward and make this even a better place. Thank you for everybody for being here.
Thank you, everyone. Have a great start to the fall semester. And again, please look for updates on the Return to Rowan webpage and for additional WebExes in the months to come. Thank you all. Have a great day.
Thank you.